Okay. Good morning to all the viewers. I'm Suhas, faculty from Discipline of Psychology, School of Social Sciences, IGNOU, New Delhi. And the topic that I'm going to discuss with you today is psychological testing and overview. Now, this is a very important topic, especially for the students of psychology. And though it as such is not one of the courses either in MA Psychology or BA Psychology, but then definitely it is very relevant. Many universities in India do have this as a separate course or subject, a subject that is focusing absolutely on psychological testing. But then as far as our IGNOU MA Psychology and BA Psychology structure is concerned, definitely we do discuss about psychological testing in various courses, like for example, under personality theories and assessment, you do discuss about psychological testing, which is a very important part of personality assessment. Similarly, in BA level also we have BPC 005, which is again dealing with personality. And further, you also have at MA level and BA level two important courses, that is practicals. And in practicals as well, the knowledge about psychological testing is very relevant besides in internship. Because when you go for internship, many times you are also asked to administer certain psychological tests. Further, when you re-register for MA second year or you go to BA third year, again over there when we talk about something like psychopathology or when we talk about assessment in clinical psychology or psychodiagnostics rather, also talk about assessment in counseling, or we talk about even in industrial and organizational setup, many a times for selection process as well, or for training related purpose as well, psychological tests are used. So that is the reason why I thought that it would be better if I discuss with this particular topic with the learners, because this is an extremely important topic and has a vast application and scope as far as psychology is concerned. Just to focus on the application part and the relevance of this psychological test for a student of psychology, as we know that we carry out diagnosis, whether it is a clinical setup or even for that matter in industrial and organizational setup, we have to carry out selection or determine which training program to carry out for our employees and so on. This particular psychological testing can be relevant even as far as school counseling is concerned, or in school setup, or even otherwise in a sports psychology setup, or even health, because you can always measure attitudes and knowledge and practices also of the general public for that matter, and for that again psychological tests can be used. So that is the reason why I have selected this particular topic, just to inform you again. Now, what are the key points that I'm going to discuss in this topic? As you can see on your screen as well, I'm mainly going to focus on what is psychological tests, what are the various types of psychological tests. I'm also going to discuss about three main important topics in psychological testing, that is item analysis, validity, reliability. I'm also going to touch on standardization and norms, and then briefly I will focus on test administration, which is again relevant when you discuss in terms of your practicals, where you are supposed to learn how to administer a psychological test. So let us start. Just to give a brief introduction, first of all, I always, in most of my sessions, I always say that essence of psychology is individual differences. We mainly are bothered, or rather focus on psychology of individuals because they are different. And again, our attempt in this is to find out what is the common pattern in behavior. How, if individuals are different, there are certain aspects that are common to us, like certain reactions that are common to us, certain the way we take stress, probably there is some common. Though we are different, there is something common as well amongst us. We also have to remember why we are different. We are also different because of our cultural background, because of our upbringing, because of the socialization. There are many factors that contribute to this individual differences. So in a way, what psychological tests do is they actually help us to measure and quantify how individuals are different. And also, if administer, for example, that is what we do in a research where we administer psychological tests to many, or for example, a sample, a large number of sample of people, participants, and then we try to find out, okay, what is an average? If there are any outliers, how many people, for example, if you want to see adjustment level of adolescents in Delhi, then what we are going to do is we are going to administer adjustment scale for adolescent, and then we are going to try to find out, whether they fall in a maladjustment, whether there is maladjustment, whether there is moderate adjustment, high adjustment, low adjustment, and so on. So that is how psychological tests are going to help us basically measure the individual differences as well as to find out what is common pattern. Probably a pattern might emerge. Oh, okay, these are the adolescents. If you say early adolescents, they seem to be well adjusted, whereas it will, of course, this is a hypothetical example. So that is how a pattern can emerge when we administer these psychological tests. Okay, then another thing important over here in the context of psychological test is that psychology mainly studies intangible entities. What is the meaning of intangible entities? Is that, the entities that we study, the variables that we study cannot be seen. For example, if there is a table in front of you, it is very easy to measure that table. You take a ruler and then you can measure its length, its weight can also be measured. It's easy because you can see that particular table. But then as far as psychology is concerned, our, entities, the variables that we study like intelligence, personality, or attitude and so on, everything is intangible. We cannot see them. But how do we measure them? We measure them through their manifestations. We know a particular person is honest, or we know a particular person is, adjusting well through his or her manifestation, through the way he or she behaves. Now, again, going one step further, if we had to measure all the behavior, it's not possible. You'll have to spend your life with that particular person. If you want to, measure adjustment of a person, you will have to actually spend life with that person to measure his or her adjustment. But obviously, that is not possible, feasible, and completely impractical. So what we do is, in psychological tests, we take sample of behavior. So for each entity, it could be intelligence, it could be personality, it could be an attitude, there is a behavior domain. Okay, and of that behavior domain, we take a representative sample, and definitely that is the reason why the whole test construction process of psychological tests is a very tedious job, and you have to be very cautious when you carry out that particular process. So we have to remember that one thing, of course, that individuals are different. Again, that is also a challenge. We have to tap that difference. So that is again a challenge for our psychological tests, and as we are going to discuss in item analysis, it will be little more clear. Further, in psychology, we are studying entities that are intangible. So that is again another challenge when we develop psychological tests. Again, we also have to focus on error variance, as you can see on your screens. And what is error variance? Now, error variance is nothing but a variability in a score that is due to an extraneous variable. For example, many a times, I do evaluate synopsis also. We have a project at MA level, and synopsis do come for our evaluation, and I see students normally measure academic achievement, with the help of just the final examination marks. Now, I say that the final examination marks are not a valid measure for academic achievement. Why? Because it is possible that the student or the learner has scored less marks in term examinations or the final examination, not because he or she is not good at academics, but probably something happened at home, or the learner was not well or could not study due to some other reason. So again, look at this. There are high chances of error variance when you take just final examination marks as a indicator of academic achievement. So definitely for academic achievement, there should be much more stronger indicator than just a final examination marks. So when we talk about human beings, definitely there is always a scope for error variance. We talk in terms of there is a total variance, and total variance is always a combination of true variance and error variance. But our attempt should be, we should try that this error variance is at the minimal, and that is the reason why in research also we have level of significance, that is 0.05 level, so that 95% we are sure that our results there are no error, or 99% we are sure in case of 0.01 level that our results are correct, there is no error variance. So our attempt is always to keep this error variance at the minimal. So these are some of the things that you have to remember, especially in the context of psychological tests as well. Now further, you also have to differentiate between psychological testing and psychological assessment. Psychological assessment as such is a very broad concept, and psychological testing would be one of the aspects under psychological assessment. When we talk about psychological assessment, you have like interview method, you also have observation, you have case history and so on. other behavioral assessment methods and so on. Okay, so psychological assessment would be one part of, you can say, psychological assessment. And of course, those who are already in second year of MA psychology, they would know that, or even, those who are carrying out their internship, whether at BA level or MA level, you know how important psychological assessment is. And again, psychological tests would be very important aspect of this psychological assessment. But then you always have to remember, especially in the context of psychological assessment, when and how to choose a psychological test. It's not always that it is required, but then definitely, suppose for example, in a clinical setup, you are carrying out diagnosis, so you interview the person, the client or the patient, and then later on, you also interview probably the significant people in that person's life, and then later on you feel, okay, I really need to clarify or be sure that the person actually has something like depression. Then you can give Beck's depression, inventory to that person, so that with the help of this very standardized measure, that is Beck's depression inventory, you can then, you kind of, strengthen your diagnosis that, okay, the person probably has depression. So that is how it will be useful, and that is how psychological tests also play an important role in the context of, say, psychological assessment. Now let us try to focus on what is a psychological test, and for that what I have done is I have selected a few definitions which is again very important to focus on, and you can see them on your screens as well. The first definition, as you can see, okay, it states that a psychological test is standardized procedure for sampling behavior and describing its categories or scores. So over here again the focus is on standardized, and we are going to again focus on this little later when we come to what are the key points in the definition, So this again, and you will find that this standardization will repeat in many of the definitions as well. And here again this definition focus on quantification, because ultimately what we get is a score, and then easily with that score we can say, if we compare that score to the norms, then you can say, okay, whether the person has really high, high on that particular variable, high score or low score. If it is adjustment, whether the person has high adjustment or low adjustment, that is how you can decide with the help of psychological test. The next definition is by Anastasi, and let me also tell you that this is a very relevant book, by Anastasi, Psychological Testing by Anastasi. If you're really interested in psychological testing and learn more about psychological tests, then you can get this particular book. Okay, so Anastasi defines psychological test as measurement of sample of behavior that is standardized and objective. So again, the focus is on standardization and objectivity as well. And again, the definition also focuses on sample of behavior. As I was telling you a little earlier, that psychological tests don't measure the whole behavior, but a representative sample of behavior, and that could be a challenge, when the test construction is taking place. So when a person or a psychologist is constructing a test, at that time he or she has to be sure, that the sample of behavior that he or she has selected is a representative of the overall behavior domain of that particular variable. Let us look at the other definitions as well. Again, this is by Kaplan and Saccuso, and this is again a very relevant book, especially if you want to understand reliability and validity. I would suggest that you can go through this particular book for reliability and validity, because it is given very nicely in this. Now, they explain psychological tests as a device, okay, or technique used in quantification of behavior that helps in not only understanding behavior but also predicting it. Again, this particular definition is focusing on quantification of behavior, because we do assign numbers, and they also term a psychological test as a device or a tool. Ultimately it's a tool. It could be tool for data collection, or it could be tool to measure a particular entity or a variable in an individual. Last definition, that is by Cohen and Swedlick, where they define psychological tests as the process of measuring psychological related variables by means of devices or procedures designed to obtain a sample of behavior. So again, as you can see, the focus is on measuring the psychological entities, and again, it is termed as a tool. And again, we also focused on sample of behavior. So these are some of the main points of the definition. That is, first of all, it is a device or a tool. Second is objective in nature. This is again very relevant. Most of the psychological tests need to be objective in nature, so that subjectivity doesn't creep in. Then it is also predictive. It has predictive and diagnostic value that is based on psychological tests. Like for example, if you give a psychological test to an employee, it could be also on something like leadership skills, and if this particular employee scores high on leadership skills, then you can say, oh, he is going to be a good leader, so I have selected well. So it has predictive value as well. It has diagnostic value as well, as we discussed in the context of clinical psychology and counseling psychology, where it can help us diagnose certain psychological aspects as well. It is standardized. Now, what is the meaning of standardized? We kept on repeating about this in the definition. Standardization means that the procedure followed while administering and scoring the test is same or uniform. Okay, so whenever a particular test, suppose it's an adjustment inventory, Bell's adjustment inventory, whenever you administer this to any of the participants, any of your participant, then it has to be done in a uniform manner. And normally the instructions and how to go about this, everything is given in the manual of that particular test. So it is important that you go through the manual and you have to follow that standardization process. The way you administer it and the way you score also again has to be uniform. Lastly, the psychological test also measures a sample of behavior, so again, as I had informed you earlier, that you cannot study the whole behavior, the whole behavior domain of a particular psychological variable cannot be studied, and that is the reason why what we do is we take a sample of behavior pertaining to that particular psychological variable. Further, we also have to remember what are aspects of a good psychological test, and for that matter, it has to be objective, it has to be standardized and so on, but at the same time it also needs to be valid and reliable. We are going to talk about validity and reliability in this particular session as well, but any psychological test needs to be valid and reliable. It also needs to have a discriminant feature, that is, it should be able to show how different the individuals are from each other on that particular variable. So for example, if it is self-concept, then with the help of a self-concept tool or a psychological test, we should be able to differentiate between people as far as self-concept is concerned. And also it has to be comprehensive, that denotes that the test measures all the dimensions or aspects of the construct that it measures. Like for example, again going back to suppose if it is the variable is adjustment. So adjustment can be in terms of home adjustment, it could be in terms of social adjustment, it could be in terms of educational or school adjustment and so on, So whatever that operational definition. Now what is operational definition? In psychology we have various definitions. Even personality, if you take personality, Eysenck has defined personality in a different way, Cattell has defined personality in different way, and then on the basis of that we have tools as well, right? So operational definition is that is what is personality according to me, what is adjustment according to me. And once I decide about the operational definition, then my psychological test, which measures this particular psychological entity, also needs to be comprehensive. So whatever the dimensions are, I need to cover those dimensions. So if it is Eysenck's, if I define my personality in terms of Eysenck's, okay, so the three aspects, neuroticism, extraversion, and the third aspect, so all those three need to be measured by my psychological test. Okay, so this is relevant in the context of psychological tests. Now let's go to what are the different types of psychological tests. The very first type is individual test, and as the name suggests, there are certain psychological tests that can be administered only to individuals. They cannot be administered to groups, like for example Wechsler's adult intelligence scale and so on. These are the tests where you necessarily have to sit with the person, the participant, and kind of administer it. So they are not possible, it's not possible for you to administer them at a group level. On the other hand, there are group tests as well, like for example many paper pencil tests like NeoPI and then MMPI and 16PF and so on. These are paper pencil tests, and these can easily be given to groups. Okay, so whichever it is possible, whichever way is possible, they can be given to individuals as well, but then these are also can be categorized as group tests. You also have two more categories of psychological tests, that is speed test and power test. Now what is a speed test? In speed test, the items that are given are basically of same difficulty level. Okay, and normally there is a time duration given, that is okay, within half an hour you have to complete this. So the items are of same difficulty level and there is a time limit. If you notice, many of the psychological tests don't have a time limit, but then the speed test will often have a time limit. Okay, and one example of speed test is clerical aptitude test, which comes under differential aptitude test. Okay, so clerical aptitude test is like a speed test. Then you also have power test, and in power test you have items that gradually whose difficulty level gradually goes on increasing. Okay, normally they don't have time limit, but then slowly the items become from less difficult to they become more difficult. And one example is Raven's progressive matrices, or for that matter any intelligence test. If you see, normally they are all power tests. Then you also have verbal tests. Of course, these are nothing but paper pencil tests like 16PF and Eysenck's personality inventory and so on. You also have non-verbal, like for example Raven's progressive matrices. If you I'm not aware, if you have not seen it, you can always go online and check what is Raven's progressive matrices. But there are patterns over there. There are pictures, and then you have to fit in. You have to, like, of course there is a way to do it. So this kind of thing, it is non-verbal because as such there is no use of language. Language is not used. Required unless of course to give instructions. You use language only to give instructions. There is also performance test where the individual has to perform, like for example Bhatia battery, and under Bhatia battery also you have Alexander's pass along test or Koblog's design test, where the participant or the test taker actually has to do something. So these are called performance tests. You also have objective tests, which are absolutely objective, and again this is again very important element of any psychological test, and they avoid subjectivity, especially on the part of the scorer, because the scoring is done in such a way that the scorer's subjectivity is not going to interfere with the tests. And over here often responses could be in terms of true or false, or there could be multiple choices. Even Likert scale, something like Likert scale where you have 5-point scale, that also can be used as far as objective tests are concerned. So the very fact that that they are like closed kind of statements where you can either answer yes or no, or true or false, or you have Likert point scale. So very fact that is there can make it objective, because then you already have the scoring in place, and the scorer doesn't actually have to interpret on the basis of the responses. So examples of objective tests are NeoPI, 16PF, all these are, you can say, objective tests. On the other hand, though objectivity is an important aspect of psychological tests, but we also have something like projective technique. Now, projective technique often is, you can say, less on objectivity, because mainly, when you administer it, or when you actually try to interpret on the basis of the responses, definitely over there the subjectivity of the person, the scorer can creep in. Okay, and the examples of projective techniques, definitely most of you must be aware, is Rorschach-Inkblot test. There is also somatic Inkblot series, sentence completion test, also children's apperception test, TAT, thematic apperception test. All these are, you can say, examples of projective tests. Okay. So these were, as we discussed, these were as far as the various types of psychological tests are concerned. That is, we spoke about individual tests, we also spoke about group tests, we then spoke about speed and power tests, and then we touched upon what are the verbal, non-verbal performance tests, and lastly objective tests, and of course the projective tests. Now, besides this, the intelligence test can, the psychological test can also be categorized into following, as you can see on your screen. So you have intelligence tests where you have Wechsler's intelligence scale for children, Stanford Binet intelligence scale, Bhatia's battery. You have personality tests as well, where you talk about like something like Eysenck's personality inventory, NeoPI, and so on. You also have aptitude tests, that measure aptitude specifically. So you have differential aptitude tests, Seashore musical aptitude tests, and so on. Then you also have interest inventories like vocational interest inventories. Then you have achievement tests as well, like mathematics achievement test, or you have Dev Mohan, probably that must have been carried out by you, administered by you during your practicals. So these are various, and then there are other entities also that I have not mentioned. These are some of the common psychological entities that we often discuss in our syllabus. But then there is also creativity. I think at BA level we do have creativity. So there is PASIS creativity test. So based on the psychological entity that you study, there are so many different psychological tests that are are available, like adjustment also, you know, there are so many psychological tests, emotional intelligence, there are so many psychological tests, but these are some of the main psychological tests that we can mention. Okay, so beside the other type, these are some of the other, these are also, you can say, types of psychological tests. So I hope what is psychological test and what are the different types of psychological test is clear. So we go forward and we talk about item analysis. Now, item analysis is extremely important, especially in the context of test construction. Okay, why? Because any psychological test will have certain items, and these are items, they could be you know, in statement form or you know, in question form as well. Okay, and again, when you kind of decide about which item or how do I have to construct an item for a psychological test based again on what it measures, you know, first of all, if you see the test construction process, I'm not dealing with that in this context, but then if you look at the test construction process, it is a very exhaustive process. It is very you know, lot of details go in, but the first step would be to decide about what is the variable that I want to you know, kind of develop a test for, and what is the behavioral domain of that variable. Okay, so suppose if it is adjustment, I want to develop a psychological test for adjustment, and then I decide to develop a test for adjustment only if there is no tool available for me. Okay, because there is no point in developing a same test again if there is already a tool which is good enough and which measures my behavioral domain. It is same like when you do your research, you know, why, that is the reason why we tell all the learners to keep on reading the review of literature. Why? Because if you are doing same thing again, what's the point? You're not adding to the existing fund of knowledge. So in a similar manner, if you're developing a psychological test for which already there is a good enough psychological test, what's the point? A whole exercise, so much of hard work that you put in would be waste. Okay, so first of all, you decide about a particular entity, and then you say, okay, you know, this is my definition of my psychological variable, and then depending on that, you develop certain items. Now, when you include items or when you are making statements for that items, again, you have to be very careful about the language that you use. There shouldn't be any double meaning, or there shouldn't be any confusing words and so on. All those details also go in as far as your item analysis is concerned. You know, you're analyzing which item should go in, what should not go in, the way to write that particular item, the words that you should use, and so on, everything, you know. And especially, as you can see the statement over there on your screens, when psychological tests are constructed, the researcher or the tester, okay, should determine how effective each item is in the test, and that is, this particular effectiveness is nothing but that is what is called item analysis. And of course, your item analysis can be both qualitative and quantitative. It can be carried out in those terms also, and your validity and reliability definitely will depend on the way you carry out your item analysis, because if the items are not correctly put in a psychological test, then definitely the test will not be valid or reliable. When we talk about item analysis, there are three main important things that we should focus on. First is item difficulty. That is the difficulty level of the item, and this is again relevant. If it is a speed test, then the difficulty level of the items is going to be same, but if it is a power test, then the difficulty level of the items is going to increase gradually. So that also you need to focus on, ki what is the difficulty level of the items that I have included in my psychological test. Okay, then the second is item discrimination, which refers to the extent to which an item is able to differentiate. An item is able to differentiate in what? In terms of like whatever my psychological entity is, you know, so whether the person is able to adjust well or not. So the psychological test should be able to, or the item should be able to, and there is a whole procedure for each item that you do it. You know, whether it is item difficulty, how can you, it is very simple to find out item difficulty. Of course, the process would be lengthy when you actually start doing it. You know, if a particular item is, many people are able to solve correctly, then the item difficulty is low. And if for a particular item, if people are not able to solve that item easily, then the item is difficult. As simple as that. In a similar manner, for item discrimination as well, whether that particular item, you know, is able to discriminate or not, and they do with the whole scale. They compare this particular item with the score of the whole scale as well. You know, for example, on the overall scale, okay, given that all the items are positive, overall scale, the person has got high adjustment level. But then whereas this particular item, this shows low adjustment level. So definitely something is wrong. No, this particular item is not in sync with the overall scale. So that is how the whole process of item analysis goes, and like definitely it is a lot of work, but very important, because without which it's not possible for you to develop a proper psychological test. So item difficulty, then item discrimination, and again last point, which is important and it is not displaying on the screen unfortunately, is distractor analysis. Now what is a distractor? If you're given a multiple choice question, there are four alternatives. Okay, one of them is a correct answer, the rest of the three, they are called distractors. Okay, and you will have many such psychological tests where you have multiple choice, and one of the choices you have to tick. Now when you have these distractors, the distractors that are not actually correct answers, again you have to be careful. Okay, how to actually have the distractors, what should they be, so all that becomes very important, and that is again very important aspect of an item analysis. That is, first of all, item difficulty, item discrimination, and then distractor analysis, so that whatever the options, the other three options, in case of a 4 multiple choices that you are given to the test taker, the other three also, what should they be? You definitely have to be careful about that as well. Okay, so these are the things that need to be taken care of when we talk about item analysis. Next, let's go to very important term, that is validity. Now what is validity? Validity, very many times when I ask the learners to define validity and reliability, they say, oh, validity is what is valid, whether a test is valid or not, and reliability is whether the test is reliable or not. Definitely I expect a much more better answer than that. And validity is nothing but it is a characteristics of a psychological test that states whether the test measures what it is supposed to measure or not. Okay, so nothing but, like, for example, let us take an example of a ruler. A ruler is a valid tool to measure length. Similar manner, a weighing scale is a valid tool to measure weight. But would a weighing scale be a valid measure to measure length? No. Right? And then the whole thing becomes more complex when we talk about psychological entities, because we can't see them. First of all, they are intangible. Okay, so how to actually make them valid is again a challenge. To actually see that our psychological test, if it is on adjustment, that it measures adjustment only and nothing else. It doesn't measure something else but adjustment. You have to be very careful. And this is again extremely important when we talk about, like, for example, we also have in psychology entities like, for example, emotional intelligence and emotional competence. Probably they would share a lot of dimensions. Certain dimensions under emotional competence would be same as emotional intelligence. But then again, your test, okay, if you're developing a test for emotional intelligence, it should measure only emotional intelligence and not emotional competence. So, mainly the test should be valid. That is, it measures what it is supposed to measure. Now, when we talk about validity in context of research, it is little different, though the concept is same, but then in research we talk about internal validity and external validity. Now, what is internal validity? That has to do with the relationship between independent variable and dependent variable, saying that the changes in independent variable are due to independent variable and not due to any extraneous variable. Okay, so that is what is internal validity as far as your research is concerned. There is also the other validity in research is external validity. Okay, and external validity is of two types: ecological validity and population validity, and that has to do with generalization. That is, whether if a research is carried out in a particular setup, it could be a laboratory setup, whether the findings can be generalized to the population, to any other setup, that would be ecological validity. Another situation would be ecological validity, and another population, suppose if it is done on students in Delhi, whether the same research can be applied to students in USA, that would be to do with population validity. So internal validity has to do with the relationship between dependent variable and independent variable, whereas external validity has to do with the generalization of the results either in situation or with the population. So this is again very important for you to focus on. There are various methods of validity that we talk about. The very first method is face validity. This is a very simple one. face validity, and probably this is done initially when you are trying to establish the validity of a test. Initial step could be face validity, where you actually look at the face value. Okay, you just go through the scale that you have developed, the items that you have developed for adjustment. Okay, they seem to measure adjustment of a person, so that is what is face validity about. Okay, so it looks like it is measuring what it is supposed to measure, but over here there is no elaborate procedure that goes in. The second type of validity is content validity, and this is again similar in a way to face validity, but then much more complex, of course. Okay, so as far as the content validity is concerned, the focus is on the content of a psychological test. Let me give a simple, little different example. For example, you order a chocolate chip cake. Okay, and you try to cut it and you see there is no chocolate chip. So what are you going to say? The cake is not what it is supposed to be. Don't give this example in your examination, but then that is the point. That is the content validity. That is, you look at, okay, this is a tool that I have created for adjustment, but then the dimensions of adjustment, that is home adjustment, social adjustment, emotional adjustment, are not reflecting. Or if they are reflecting, so that is how you look at the content. And over here you could also use certain qualitative and quantitative methods. Correlation can be computed and so on, to obtain the content validity. So that this is definitely face validity is just the face value. You look at the face value, but in content validity it is little more elaborate. But again, most often what we do is this again is done at the very initial stages of establishing the validity of that particular scale. The next is criterion validity. Now, what is criterion validity? Criterion validity is nothing but the extent to which test takers' scores on a measure are correlated with other variables, that is known as criterion. For example, if it is a leadership scale, so what we do is a leadership scale is kind of administered to a group of employees or a group of people whom you want to select for a particular job, and you compare that with, like, say, probably actual scores of certain leaders on leadership scale. On the same scale, it could be same scale or it could be different scale. Okay, so there is a complete criteria, a standard, against which you kind of compare the scores obtained by, obtained on this particular scale that you have developed. Okay, now under criterion validity, you talk about again concurrent validity, where the criteria is measured at the same time as the construct. Okay, so if we talk about the leadership scale that you have developed, you administer the leadership scale on a group of people, and then again, the criteria that is, at the same time it is compared with that particular criteria. The criterion is also administered at the same time. It could be another scale on leadership as well. That is also possible. Then there is also predictive validity under this. That is nothing but construct measured initially, and the criteria is measured at some point in time. Again, let us take the leadership example, where you administer the leadership scale, okay, on these particular group of people, and then after 6 months you see whether they actually display leadership skills or not, or you kind of measure their actual leadership behavior or something like that. So future, so this is a predictive, because this is done later on. That is the reason why you say that this is a predictive validity. There is convergent validity as well, where criteria can also include other measures of the same construct. For example, suppose if you are measuring stress, okay, then you can suppose you've come up with occupational stress like scale you have developed, then to see whether it is valid or not, you can correlate with another job stress scale that is already available. So if you see there is a positive correlation between the two, then definitely you can say, oh, that is measuring job stress, mine is also measuring occupational stress, so definitely my scale is all right. Okay, so that is what is convergent validity. And there is again discriminant validity, which is little different from convergent validity, where it is the extent to which scores on a measure are not correlated with measures of variables. What we studied in the convergent validity was that you correlate it with a similar psychological entity or similar scale, that is yours, you have developed a scale on stress and you measure, you compare it with another scale that is also measuring stress. But in discriminant validity, what you do is you measure it with a variable that is different, completely, conceptually completely different. Like for example, if you take you have developed an occupational stress scale, then you can correlate it with psychological well-being. Obviously the correlation will be negative. You know, you take a variable that is a complete, like distinct from this particular variable, so that it shows that there is a negative or no correlation with that, then you can say that okay, probably my scale is valid. Okay. Then last method of validity is incremental validity, and that is used to establish whether the present psychological test will provide more information about the psychological entity, okay, than already there. That is the point that I was telling you before, that is, you should not develop a psychological test, you know, if there is one which is very good enough and already it is available, but if it is not good enough and you feel that it is not doing justice to the variable that I have taken, then of course you can go ahead and you know, kind of develop that psychological test. Okay, but that is what is incremental validity, that is whether the test that I have developed, it has provided some more information or not, whether that has been done or not by my test or not. So that is what is incremental validity. So that is as far as your validity was concerned. I hope it is clear. We discussed about what is validity, that is what it is supposed to measure on, measure what the test, whether the test is measuring what it is supposed to measure or not. And then we also discussed about what are the various methods to establish validity. Now coming to reliability, reliability of course, the first thing that should come to your mind is that consistency. And this is reliability denotes whether a particular psychological test is consistent over a period of time or not. Like again, taking this thing of ruler, the example of ruler, you know, it is very easy because the ruler is not going to change unless it is damaged or, you know, it is broken or something like that. It's not going to change, you know. And if you measure the length of a table, say 6 months before and 6 months later on, you know, obviously it will remain the same. So you know that, you know, you are not worried about the reliability in that context. But then what with human beings? First of all, human beings do change. Okay, and definitely, you know, over period of time human beings change, and then our psychology, since we also measure psychological entities that are intangible, again our challenges are manifold. And often reliability is not only in terms of time, but it is also in terms of items and also in terms of the scorer. So, you know, you talk about the internal consistency as well, you talk about inter-rater consistency as well. So, of course, the example I have already discussed, you can look at it on your screens, but that is what is reliability about. That is, when we talk about reliability, we mainly focus on the consistency of the test, of the psychological test that we have developed. Now, there are various methods to test reliability as well. The very first is test retest reliability. As the name suggests, over here what is done is basically the same test. You have developed a test on, say, self-concept. So you first of all administer this test to a particular group of people, okay, and you obtain their scores, and then after 6 months or after a particular period of time, again you re-administered the test, again same test to same group of people, and then you correlate. Okay, and a correlation is computed, and obviously it has to be positive. If it is positive and it is high, then you can say that okay, you know, there is a correlationship between the two variables. Okay, not two variables, between the two tests, the first administration of the test and the second administration of the test. But then what happens, there is one problem with this test retest reliability, though it is very simple in a way, but the errors can occur mainly when there could be practice effect, because it is the same test. So there could be practice effect, there could be maturation, also there could be a memorization of items, or learning has taken place. So, you know, the time gap that passes between the first administration and the second administration, whatever has happened during that time gap, could be maturation, learning has become better, you know, or even there is a practice effect, or there is memorization of the items. Many of us could remember the items, you know, that we have answered in the first setting. So all that can interfere this thing, and in this case what can happen is the test scores could be higher when it is administered second time than the first time. So that could again could create issue when you are trying to establish reliability with the use of this particular method. To counter the issues as far as your test retest method is concerned, you have alternative form method. Now what is done over here is, there is two scales are created. Like for self concept, if you created one scale, then you create another scale, and both the scales are administered at the same time. Now with this, of course, we took care of all the errors that were there with regard to the test retest method, but creating one single psychological test is such a difficult job. Imagine creating two psychological tests. That is like, a lot of work. Okay, so that is one of the challenges as far as alternative form method is concerned. The next method is split half method, and this mainly focuses on internal consistency. And what we do over here is to counter what we talked about in test retest, and then with what we talked about an alternative form method or equivalent. Alternative form method is also called equivalent form method, where what you do over here is only one test is developed, but then you split it into half. The first 150, suppose there are 100 items, the first 150 items and the next 50 to 100 items, we divide them and then we correlate. Okay, but then this could be difficult mainly when you have something like power test. Why? Because what will happen is the first 50 items, if it is a power test, the first 50 items would be extremely easy and the next 50 to 100 items would be difficult. So it doesn't make sense, right? Another way in which you can split is all even together, all odd number items together. This is one good way to do it, especially with if you have a power test as well. This can be done. That is, you take all odd items and then even items, and then kind of they are correlated with each other. So that is one way in which this can be done. Okay, and then later on, I'm so sorry. Okay, later on, Spearman-Brown prophecy formula is often used because, in case of split half reliability, what you get is reliability only for half the test. So to obtain reliability for full test, certain formulas are, you can say, applied. Okay, so this is again, this is especially effective, this particular test, when you have a large number of items. So this particular test can be this particular method of reliability can be used by you to establish reliability. The next one, that is Cooder-Richardson reliability, and this particular reliability also focuses on inter-item, you can say consistency. Okay, and it is mainly used for psychological tests that have items with multiple choices, or there are fill in the blanks, or there are certain short answers and so on. With those, Cooder-Richardson reliability can be used, but this is where it is very important over here, because it measures inter-item consistency. So that is the reason why the items that are there in this particular psychological test should be homogeneous. They should not be extremely different. Okay, because if they are heterogeneous in nature, then with the help of this particular Cooder-Richardson reliability, what will happen is the inter-item, the correlation, if you compute between the items, they could come negative, and then you will not be able to kind of establish the reliability. So it is very important that this particular reliability method is used for psychological tests which have items that are homogeneous in nature and not heterogeneous in nature. There is also coefficient alpha, which is in a way you can say extension of Cooder-Richardson reliability. Again, it mainly focuses on internal consistency, and these are mainly used for tests that have more than 2 answers, and thus can also be used for Likert scale. Likert scale, that is 5-point scale, it can be used for that as well. And often a lot of statistics is involved, though I am not focusing on the statistics part as far as today's session is concerned, because again we are talking about overall psychological tests and not specifically on validity reliability, but then there are a lot of statistical tools as well that you use to establish validity and reliability, and it can be easily done with package like SPSS, statistical package for social sciences and all can easily help you to establish reliability of your psychological test, provided how you know how to key in the data. Okay, so this is as far as your 2 important reliability and validity is concerned. There is one more that I missed, that is scorer reliability, and scorer reliability is nothing but, I was talking about inter-rater reliability, that you also need to kind of focus on, error variance can also result from the way the scorers are scoring the test. So that is what is scorer reliability, and this can easily be taken care of by following this procedure, where a single test, you know, two scorers can be asked to score a single test, and then the way they have scored the test can be correlated, okay, and then that will give you your scorer reliability. Standardization and norms. In the overall process of test construction, again, standardization and norms play an important role. That is mainly, as I spoke about standardization, the procedure, the instructions, the scorings need to be uniform. The way you actually do it, you know, again, as I said, whenever you are asked to administer psychological test, you have to go through the manual properly. Okay, you have to read the manual from first page to to the last page. Okay, and you have to see what is the procedure to be followed, how everything is to be done, what are the instructions given, and you have to, as much as possible, the same words you need to use, you know. And of course, a extensive scoring procedure will be given. Sometimes there are scoring keys as well, you know, so you need to use those and then carry out the scoring. But then very important, then this is why we have standardization, because of, again, error variance, to reduce the error variance, okay, to reduce the scores, you know, to be due to chance factor. You know, you do not want like a person's, I remember when we were students, and you know, in fact we were doing Raven's progressive matrices, and you know, we were just doing it on each other, and there was one particular classmate who got completely low score. It's not possible. Obviously the person was doing her masters and was not having any kind of intellectual disability, but then her score was low because she was a little bit disturbed and she was not you know, kind of prepared to answer the psychological test. So these are some of the chance factors, you know, or extraneous factors that can interfere with the you know, the test taker, and then it is possible that you know, the scores on the psychological tests that we receive are not because they are not indicator of that particular psychological entity in the person, but because of some other extraneous factors. You know, so that is the reason why the whole process is to keep all these extraneous factors to the minimum. Okay, so that is why once we have done item analysis and we are sure that our items are good enough, we do validity, then we do reliability, and then we create this procedure for our administration of psychological test. Okay, and we write down what are the instructions and how the items are to be scored. Besides that, we also have to establish norms. Now, establishing norms means what? Now, our psychological test is already ready, and we can say it is also standardized. We can say that, okay, it is valid, reliable, and it is measuring what it is supposed to measure, and we know it is a good tool. Then what we have to do is we have to administer to a large number of people. Okay, and then, like for example, let me take an example. Suppose if I want to, you know, suppose height of, say, Indian men. Okay, of all the men in India, how do we know? We are going to measure the height of a large number of men, like say a particular age group, you can say. Okay, and of course height will not change after a particular age group, so you can say early adults. Okay, we measure the height of early adults, and then we have this particular data where we get an average height. Okay, and it will come as a normal distribution curve, where there would be people who are little bit you know, who will have less, like who are shorter than the average, and there would be people who are taller than the average height that we obtain. And then what we do is, suppose if I want to compare your height, if there is a friend of mine, you know, and I want to compare his height. Okay, then what I'm going to do, I'm going to compare his height with the average. Okay, and then it will say, oh, you know, he is taller or he is shorter than the average. Now this particular average will differ, because in the average height of men in India would be different from average height of men in, say, Japan, or average height of men in Germany. You're getting the point. So the norms for height in India would be different from the norms for height in Japan and norms for height in Germany. In a similar manner for psychological test as well, suppose it is adjustment or whatever, whichever entity it is, you know, you have to create norms for those tests. So if I have developed a test on adjustment, I'm going to create norms, and then I'm going to administer it. Suppose it is for adolescents, I'm going to administer it on adolescents, and I'm going to generate some norms. So I come to know which score denotes average adjustment, which scores denote low adjustment, which scores denote high adjustment. So the next time when I administer this adjustment scale to an adolescent, when I receive his or her score, I can say, oh, this is where he or she falls. And that is what is the relevance of norms. And if you look at the manual, behind the manual, after the procedure for scoring, they give norms and there is a table which you have to read. And then you can accordingly interpret the scores of the participant, on whom you have administered the test. So I hope it is clear so far. Okay, and that is the reason why again standardization norms are again relevant, especially in the context of test construction or when you are administering a psychological test. The last part that I am going to discuss about is test administration, and this is again very relevant when we especially talk again in terms of your practicals, or also for that matter when in terms of when you carry out data collection for your project. So as far as test administration is concerned, these are some of the points that you need to focus on. First of all is selection of the test based on the purpose. Okay, so purpose could be research. You are doing a research, so you want to collect the data for that purpose. Or for example, a child has come to you. You are probably doing your internship, and your agency supervisor has asked you to administer an interest inventory on the child. So what is the purpose? Select your test again for that matter. Now for example, personality, there are so many personality tests available. Which one should you select? Again, that will depend on your purpose. If you want on many factors, you would go for 16 PF. If you want just few factors, like 5 factors, that is big 5 factors, that is NeoPI, then you would go for NeoPI. So that will again depend on what is your purpose. There are various types of proper standardized psychological tests available, and you have to select based on what is the purpose for which you are administering the test. The second is understand the background of the test. Okay, very important. I remember when I was doing my PhD and the test that I was using for my data collection, my guide asked me to go through it and find out its background. I had to read its manual and so on. So that is what you also need to do. You look at the term. Like for example, if I say Raven's progressive matrices, why is it called Raven's progressive matrices? Because it was developed by Raven. Progressive because the items level the level of the items goes on increasing, and matrices because the pattern of drawings that are given in Raven's progressive matrices, they are like square, so that's why matrices. For example, Bhatia battery. Why is it called battery? Because there are various subtests in Bhatia battery. So why a particular name has been given? Please do some study, you have to do that on your own as well, not wait for someone to actually teach you. And now with so many valid information available online, please go through it and find out. It would be very interesting, to do that. Again, after that, you have to thoroughly read the test manual. Very important. As I always tell my learners, please read everything that IGNOU gives you, whether it's program guide, handbook, go through IGNOU website, all the information is available. In a similar manner, you also have to go through the test manual. Because they will also give you the operational definition of the concept, adjustment or pursued parental behavior, for example, what exactly it kind of measures. For example, if you talk about parental behavior, there are psychological tests which actually measure parental behavior in the sense it is to be administered to parents. On the other hand, there are also certain psychological tests that measure how the parental behavior is pursued by the children. So all this is relevant when you talk about, because many times in synopsis as well, when you mention, if the scale is to be administered on parents, then parents also become your sample, but the students will forget to mention that and just going to write about the children, So all that you have to take care of. So thoroughly go through the test manual. Whom is it meant for? Parent or children, or what are the dimensions, how the scoring is to be carried out, what is the standardized procedure, instructions, and so on. Once that is done, then you also have to focus on whether it's a group test or an individual test. Okay, so we have explained this already. So if you want to administer, like for example, if you're doing a project on, say, school children, it's possible for you to go to a class and administer the test, paper pencil test on a group of student. But if you're using something like PASI's creativity test, then obviously it cannot be done on a group of people, but you have to do it individually. Then also focus on physical environment, which is again very important. That is, it should be distraction free. Why? Because if there are distractions, again, what is going to happen? It will add on to your error variance, and your error variance will be high. So free from any distraction, even free from visual distraction, noise distraction. The lighting should be proper. At the same time, the temperature should be proper, so that the person who is taking the test is comfortable. And there are various ways also which you can sit, like face to face is one way. Now suppose if you are administering a test on a child, then it would also help where you make the child sit next to you, so that if the child is stuck, you can always explain to the child. Or it could also be that you are sitting over here and the person is sitting over here. Okay, because when you are administering the test, you also get to observe the non-verbal behavior of that particular person. So all these things become very important, and observing the non-verbal behavior is extremely important if you are administering a test to you can say make a diagnosis, like in clinical setup or in counseling setup. Then sitting arrangement, I already discussed about that. Okay, it should again be comfortable. Okay, and pre-administration preparation, before you administer the psychological test, before the person enters, and this is for your practical also, please, whatever the material that is required, if a pencil is required, sharpener is required, rubber is required, everything, eraser is required, everything should be ready beforehand. It's not like the person is sitting and then you are running around to get the things, whatever the test booklet, it should be ready, it should be placed in front of the chair where the test taker is going to sit. So be careful, and all these are given, whether it is the book by Anastasia or by Kaplan. There is another one, complex one by Freeman also. All these things you can go through the books as well. Another important aspect is of course ethical issues like informed consent or confidentiality, privacy, and all that also is important. Now what happens is, many times when we administer a psychological test, we don't directly tell them about what the psychological test is, and especially when it comes to research as well, because there could be something like social desirability, right? So in that case, of course, later on you have to kind of debrief the test taker. All that also needs to be done. Okay, but then whatever, see to it that you follow all the ethical issues. Then keep in mind the individual characteristics while administering the test, like for example age, gender, and so on. All these things are again to be kept in mind when you are administering the test, and accordingly make the preparation. Rapport, again extremely important. Rapport, you have to build rapport first initially. Just don't start. Now if you know the person, of course you will already have the rapport with the person, but if you don't know, then definitely rapport has to be built with that person. While administering the test, the instructions used to, instructions that are to be provided, again you have to be very clear, and you have to ensure that the person who is taking the test has understood these instructions. Clarify doubts, any doubts you can ask, okay, these are the instructions, do you have any questions? Clarify the doubts, whatever they have. Again, all this we are doing so that your error variance is at the minimal. Debriefing is nothing but like after the test, already you have given the test and you receive the scores. After that you inform the person what actually the test was about, if you have not informed them beforehand. And you also have to take introspective report, that is what was the overall experience of the person when he or she was answering that particular test. So that is again important. Scoring and interpretation strictly have to be carried out as far as the instructions given in the manual is concerned. And then lastly is reporting. Again, the way you report and interpret, in the interpretation, how you mention is again important. And this again would be important when you are doing it in a very professional setup. So for example, in a clinical setup or counseling setup where you have to provide the report to the test taker, then there would be a proper format in which the report is to be presented. So this is as far as the psychological testing is concerned. Just to summarize, we discussed about what are psychological tests. We also focused on what are the different types of psychological tests and its relevance and scope as well. And then later on we discussed about the three important components, that is item analysis, reliability, and validity. We also briefly discussed about standardization and norms, and lastly we spoke about test administration. So I hope this particular session was helpful to all the learners. If you have any doubts, you know that my email address is available on IGNOU website. You can please get in touch with me, and if you have raised doubts on the Facebook page as well, it would be my pleasure to answer them, and wish you the best. Thank you so much.